So how the title says, this time I will speak about my diagnosis with breast cancer. I took some notes so I don't lose path of the story and the main points I want to mention, particularly about my symptoms, what blood tests I had before my diagnosis, and also my recovering process and what I'm doing not only to overcome my side effects but also to heal both physically and emotionally because it hits you very hard. I will also mention how I found out about my diagnosis, so I hope my story can help others, especially if you don't know where to start. Or also, I want to point out that if you have any of those symptoms, it's not linked. It doesn't mean it's linking directly to cancer. Remember, each one of us has a different story. I mean, this is only to help others to, as I said, don't know where to begin, if they feel weird, if your body's calling you and telling you that something wrong, then listen to it. As I said, and also I would like to mention that any of my advices on what I'm doing to overcome the side effects and to improve my health, it's my own experience. Don't take it as it is. Always consult a specialist and do your research. So let's begin with how I found that I had breast cancer. So in 2019, after finishing my PhD, I came back to Germany at the beginning of the year with, at that time, my boyfriend, and we decided to start life here. This year, my mom planned her holidays to come and visit us or visit me, and she found out she had breast cancer. So it was very, of course, devastated news. But at that time, I just moved back to Germany from Mexico, where I'm from. So yeah, I was struggling with the job situation, financial issues, so I couldn't be there for my mom. Anyways, that time it was very hard for me. I mean, of course, it was even harder for her. So she overcome she went through chemo and everything, and I remember I was not that informed. But since then, no, actually, before me coming back to Germany in 2019, I had an ultrasound, and when I visited my gynecologist, she found out I had a lot of fibromes. So she told me, did you ever notice that you had a lot of fibromes or notice anything strange? And I said, no, but I usually, during my period, I have pain in my breast. But other than that, I am informed that this is kind of normal, isn't it? She said, yes, but we should just, monitor these fibromes. Okay. So then the diagnosis of my mom came, and yeah, later that year, in 2020, before the lockdown, in January 2020 to be precise, I did my second ultrasound and my first mammography. Usually in our age, that is the information I have, is that a woman, premenopausal woman, mammography is not required. But do my historical background from my mom, let's say I was put more attention to it. So when I mentioned this to my gynecologist here in Germany, she gave me like a prescript to go to the radiology and make the ultrasound and the mammography. So that was done in 2020 in January, as I said, and everything apparently came normal, nothing to be worried about. Then on 2021, in January, again, exactly 1 year after, I did again the mammography and the ultrasound. At that time, I changed my gynecologist. I was kind of not happy for the first one. I don't know, it just, the chemistry wasn't there. So I changed it, and I felt that she put more emphasis on me, particularly because my mom going through breast cancer. So again, in January 2021, everything came normal, nothing to be worried about. Again, fibromes, everything normal. But in April, the same year, I mean last year, I was with, at that time I was living with my boyfriend, and usually I always ask him to help me to test myself if he notices anything strange. So I remember that I just asked him again, and he noticed that there was a very hard lump in my right breast, that it wasn't there before. So that night, I don't remember exactly the facts, but I was showering and I really noticed, okay, this is very hard. I did not feel it before. That's weird. So at that time, Mama was finishing her second treatment also she was done with chemotherapy, and she went through something that is called, well, I will put it in the description down below and also here, but in Germany it's Antibody Therapy. So yeah, she was going through this. So basically this therapy doesn't cause you hair loss or heavy side effects. So she was recovering and she was basically finishing her treatment. So I remember I mentioned this to my mom, and she also did not worry about anything. She said it's probably something like a fibrome or something. And if it's hard and if it doesn't hurt, well, nothing to be worried about, but it has to be checked. You had to let them check. So just to mention, I will make a break here because I want to speak now about the symptoms I previously experienced before this diagnosis. So until here, I just want to let you know that I felt that there was a big lump, and it wasn't there from January and April. So from January wasn't there, and April something grew. So now let's talk about the symptoms. So I think I mentioned in my first video I post, but if you haven't watched, it doesn't matter. I mean, of course, go and watch it, but I will mention it anyways. When I was young, I suffer from eating disorder. I will not go into this topic, so I didn't have a very healthy eating habits. Although my mom always teach me how to eat properly and something, things that teenagers go through. So I really went through, I harmed my body heavily. So in 2011, when I moved to Germany from Mexico, of course, things changed. Not only the climate, which is very important, but also my eating habits actually got worse. And of course, my life changed. I mean, this level of study I was doing my master degree, and the demanding of study was completely different from the system I was used to. Besides, I was young, I was partying a lot, so I was barely having sleep. And one thing led to another. And in 2010, I suffer from, I was categorized with anorexia here in this medical system, and I was underweight. I had everything you can imagine, like lack of minerals, and something that noticed so hard, it was my hair loss. My hair was literally falling like if I would going through chemo. And of course, because it's your hair and you notice, you worry right away, right? It doesn't matter the rest, but it's your hair. So it started falling like literally. I remember that when it started, it was in September, I think 2010. And it was a time my mom visited me because she was very concerned about my underweight. So my hair was falling, and then it recovered. And since then I was like up and downs, and I managed to come back to a good healthy habits. And yeah, then I met my boyfriend in 2011, I think. And since then, yeah, everything somehow, there were times I recovered from my hair. So my hair since then was always an issue. It was never 100% recovery. And it really, really affected me psychologically. I was talking about it all the time, and comparing myself when I was younger. And of course, then I moved back to Mexico in 2014. And in 2015, I started my PhD. My boyfriend at the time came back to Germany. So all this stress from moving back and forward, my studies and my relationship, I believe really triggered my hair loss much harder. And of course, yeah, I don't know, probably, yeah, the cancer somehow. But let's go back to the symptoms. So in 2019, I noticed that when I finished my PhD and I came back with my boyfriend, because he was in 2018, he moved back to Mexico with me and we just lived there for 3 years, and we realized it did not work out living there. So when we came back, I really noticed my hair start falling right away. And something that is very important to consider is vitamin D. So for instance, I never had any issues about sun because I come from Mexico, but in Germany, yeah, there's times when the sun is just simply not there, especially, of course, in winter. So I noticed that my hair was falling, and of course, if my hair is falling, what I do, I take action about it. So I started visiting doctors. I started from my general doctor. So I did my research because I was reading a lot. As a scientist, I'm a person who is very objective, so I need facts. So I did my research, started watching YouTube videos, reading articles, scientific articles. So I started really digging into this topic of hair loss. So I searched from, okay, I said, what can I do? Nutrition, okay, stress. So I went to do my analytics, and my analytics came back like this. So ferritin and vitamin C were very low. So the doctor told me this is probably what's triggering your hair loss. So don't worry, you just need to take supplements and everything is fine. But I ignored all the symptoms. Other symptoms I had besides hair loss was insomnia, like heavily. I have it was like a non-stop in my head, like when the TV is on, and it was just no pause. It was just running, thinking things, and I was very tired. So insomnia, and I had heavy periods. My period was very regular. Something I also forgot to mention is when 2011, when I suffered from, let's call it that way, anorexia or eating disorders, I lost my period for 8 months. So that was I put my body really under stress. So coming back to the symptoms, besides hair loss, insomnia and heavy periods, but regularly, I also have a very moody, like seriously moody, my character was, I was mad all the time, especially during my period. But as everyone tells you, oh, you're a woman, is the hormones. Well, actually, in fact, they were the hormones, because then I will go move forward to my diagnose. So yeah, people were not that wrong that the hormones were playing some role. But when you think about hormones, you think about thyroids. So I went to see an endocrinologist, I went to see a dermatologist, and with the dermatologist, it was, she just told me what I said. I said, yeah, I think I might have alopecia androgenetic. This is a diagnosis that, yeah, your hair start falling like this male pattern from here, because I will show you here some pictures, how it looked like at the beginning, like when I no hair loss, and then I will show, I don't know which pictures, but I will put it here and the dates. So you will see I was really losing hair, but I was told that I was exaggerating, and I was really not exaggerating. Like my hair was really falling, so I had to cut it, and it was falling. Here there are some other pictures after the shower. So I did my research, still like, what can I do? I started investing in vitamins, and it helped, some of the vitamins that my dermatologist suggests me, but it just helped half a year. I start eating a lot, but I also realized another symptom is I was actually not gaining weight. Actually, I was losing weight. So I thought maybe it's because I walk a lot, I do exercise a lot, I'm under stress. So shampoos, supplements, very expensive, even minoxidil. It was helping, like minoxidil did not really help me. I just start growing hair in my ears. So it improved, my hair improved. Actually, here is a picture which you can see the difference and improve a little bit, but not significant. So something is really wrong, and trust me, when you need to listen your instinct. This is one of the points I mentioned from my previous video of habits of happiness. Listen your instincts. Don't overreact, but there is a point then you in your guts, you feel something is wrong. Like I'm doing everything What else do I need to change? Well, probably my relationship, which actually that was it. I broke up a lot this year, but at that time I was like, no, something I need to change. Okay, if I'm under stress, if I'm a very moody person, I will meditate. I started meditating with the information I had and going out with friends. It wasn't working. It wasn't working. And of course, I was affecting my surrounded, my friends, my beloved ones, for instance. So I really needed help, and I was suggested just maybe you should go to a psychologist. Well, so let's come back now. That was the symptoms, a little bit of my background about what happened with my hair loss and everything. Now let's come back to the diagnosis. So with the diagnosis, as I mentioned, I felt like a lump in April, and I went to see my gynecologist. I remember that I called her and she said, well, we just saw each other in January, like it's too soon from January to April, like what is it? So I mentioned, I remember I was talking to their receptionist because they were like, usually you should come like every 6 months or in a year, like what is going on? And they're busy, they have much more patients. So I said, I felt a lump that I did not feel in January. So the moment I said this, right away she booked an appointment for me next week. So I went to see my gynecologist, and she felt it. She was like, I remember I saw this, or I even felt it in January. She took out the documents and the mammography, and she said, no, so weird, I don't see this. Okay, can be this and this and that, and let's make a biopsy. So she doesn't do that. I have to go to another clinic. So she gives me again a transcript or a pass. I don't know, here it's called Überweisung. So I got it. I wasn't worried at all. My family neither. Everyone was very positive. I was like, of course I should not worry. I'm like, it cannot be my mom just finishing her treatment and then me. No, that would be like, no, what are the odds? So I remember I went there and they pinch you. Well, they put you anesthesia. It wasn't that bad. I have a big phobia to needles. So I was more over dramatizing everything. After the biopsy with the needle, I went back to the clinic for the results. I remember exactly, it was the 7th of May. And I was driving at the time with the father of my ex-boyfriend. And I remember I arrived. Usually they have you in the waiting room and they don't attend you right away. Sorry, I need to look at my battery here. So I remember I arrived 20 minutes before the appointment, and exactly I was like, okay, I will probably wait 40 minutes. And when I arrived, they said right away in German, Frau Gilabert, like Mrs. and my second last name. And at that moment, I swear, I felt this is not okay. They never call you before the appointment, and not even 20 minutes before my appointment. I remember I felt like something in my stomach, and it turns everything like it was real. So I remember I went into the office. The doctor closed the door. She was very serious. She was very funny, talking to me about her holidays in Mexico when she did the biopsy, and now she was so when she gave me this news, it was like a dream. It was like I lost reality, but I kept myself in control, and two questions came out of my mouth. Number one, which stage am I? And the number two, is it a spread? So she answered me, we cannot know, as we need to make more tests. So I suggest you to go, and she started telling me what to do. I just couldn't take it. And I think she noticed that I was lost, that my eyes were simply, my brain was simply not there. And I remember I just wrote my mom, I have cancer, and she did not reply back. Then later I knew that I know, sorry, later I was informed from my dad that she just couldn't take that news and she passed out. So I remember I also called that moment to my ex-boyfriend, and he also stopped. He was like, it's not true. He just stopped with this joke. Say there's no joke. He couldn't keep on working. And at that very moment, the doctor really helped me to make the pertinent calls. Like, for instance, right away next week, I already had an appointment with the MRT. I will put here the name. It's a tomography to see whether it's a spread in the thorax, in the lungs, and then I think another one where you get a contrastimeter, and you go through this big machine to see if cancer is spread, I think, in other organs. I don't remember which ones. I will put them here. So it was week after week. As I said, this day was 7th of May. That day, we came back home. My ex-boyfriend called right away my boss, and she said, don't expect Chris to come over anytime soon. She had breast cancer. So the name of my diagnosis is this. And basically it's a very aggressive one. I mean, every cancer is aggressive, but this one is, I think it's the second or the third most common. And they don't understand the behavior of this, like why in January they did not see the tumor and suddenly from January to April it grew that big. But apparently, I mean, I don't like to read that much. I rather read about what can I do to improve my health, because then I get too overwhelmed. But I don't know, is that yeah, they're doing research and they don't know exactly why it behaves like this. So at that very time when I get the diagnosis, my mom just finished her treatment of the second treatment of breast cancer. So you can imagine how crazy this was. Like, what are the odds? So I made a gene test. I mean, I did not made it. I let myself made, and it came negative. I think they scanned 25 genes, but the doctor said this is also not, that doesn't mean that it's not genetic. It's just that there are many genes to discover, but at least the most commons, which are, I think, these 5, it's negative. So nothing to worry about. Yeah, okay, cancer is already there, right? But it's not genetic. So which means is that they don't need to remove my other breast. So I was informed. I went through a lot of you can think I start my chemo. I will put here the date, but it was at the end of June, if I remember, 26th or 29th of June, I got my first chemo. Oh Lord, that was crazy. Like, I was not expecting the side effects. I remember I was talking to the oncologist, very nice person, and he just told me, don't worry. He was very positive. Just do keep doing your normal life. Well, I don't know. The other people, for instance, my mom was very strong, but I have to tell you something, which is very important. Not that I forget. Muscular mass is very important to overcome any medicament, any disease. So I remember from my mom experience that she had, like, of course she was also not telling me much, me in Germany and she's in Mexico, to worry, but she went through a lot of pain. But she told me when she went through my process also, she said, because we were, video calling each other, so she said she never had the side effects, not all of them that I had. And I will show you here some of them. Like, for the worst, I think it was that it burns. It feels like really literally they're putting fire, turning fire here in this part of the esophagus. And of course, a change of taste. Here are just some change of taste. You have so much pain in the articulations. From one day to another, one goes away and then start another. I had, I couldn't go to toilet, and then it was like change of taste, everything salty. But the worst one was this is a picture, sorry if you're very sensitive, but I came with a lot. I think that was between my fourth chemo, 4, 5, 6, like this spots around my eyes. It was so painful, it was so dry. I don't know if anyone has gone through this. I did my research and I couldn't find like a YouTubers or some information related about it. But as I said, I was also I tried not to read that much. So, because then I get so overwhelmed and probably my side effects will intensify. So when I mentioned these side effects, because you have to let them know in the clinic, they were a little bit surprised because they say, well, we haven't experienced that with other patients older than me. But then I found out I'm too skinny. Like I was, even if I was eating well, so my lack of muscular mass or the little I have, it wasn't enough to overcome the side effects of the medicament. So from June till exactly I think 12th or 13th of October, I had my chemos. It was 6 every 3 weeks, and then I went through an operation. I always was informed, or maybe I understood wrong, but that I will keep my breast and they would just remove the tumor. But unfortunately, the tumor was too big. Even if it reduced from size, somehow it developed roots. So to avoid any kind of risk in the future, they decide to remove it. So it's mastectomy, but I keep my skin, I keep everything. They just put an implant, plastic surgeon, of course. And then I went this year, February, to rehabilitation for 3 weeks. So do my diagnose is, I think, is HR positive. Oh, I will put it here. And it means that it has a high affinity to estrogens, to the sexual feminine hormones. So they have to block me. So I use something that is called Zoladex. It's like a needle that I have to receive every month for the next 5 years, now 4 years. And I have to take a pill that is called letrozole that I also have to take every day for the next 4 years. That means I don't get my period. And yeah, this year, as I said, I finished my chemo October, then I went to operation in December, and in January I start, they call Antibody Therapy. I will put it here in English. And this is yeah, it's also kind of a chemo, but the side effects are not that strong, but you also get side effects, especially too much dryness in the nose the first days. And of course, always you get tired, and yeah, you simply just you are not 100% fit. My hair has grown. This is something I also would like to mention, maybe in another chapter from this video, how my hair grew. So this, I did a lot of research. Okay, let's talk about it right now. Oh, my hair. I saw my mom, because my mom has a thyroid problem. So I saw her hair grew so much, so dense, so thick. And I was like, I already suffer from hair loss. So I kind of was happy and relieved that my hair fell out. And I was like, okay, but it's gonna grow very strong and healthy and abundant and beautiful and curlier. So when I finished my chemo, remember, it wasn't coming in October. And then I was watching videos of other people going through breast cancer, and they were, after 4 weeks finishing her chemo, their hair was growing and mine wasn't. But of course, again, everybody's different. Every diagnosis is very different, and I still have to go to under medication. So I was not understanding. I was very impatient. So I was like, Mom, it's not growing my hair. I was watching me every day in the mirror until when I saw some of them, I was happy. Then in January start really growing. And when I start the medicament, the second part of the treatment, which is again the Antibody Therapy, I should stop the video and look for English, but it's here. So as Antibody Therapy, of course, I noticed my eyelashes start falling again. Actually, my eyebrow right now is, I have makeup, but yes, I used to have a very thick eyebrow. I hope it comes again. I'm positive. It just falls and comes again. So this is something, if one of you can provide me some feedback, because it tends to fall and then come back again. So with the hair is the same. I actually noticed that the last, and still the very tiny hair is in this area, but that's of course because there is less blood circulation than here. So yeah, my hair is getting thick, it's getting stronger. Sometimes it falls from here, but again, I'm confident that everything is gonna come normal. I mean, of course, I'm healthy. That's the most important, right? The hair is the last thing, but what can I do? It's a feminine identity, our hair, right? So I noticed in January, once I started getting my shot, it was like very weak, not as strong as I noticed. So again, I was informed just to be patient, and it's not over. Actually, it's not over. As I said, I just got on a what is the day? Yeah, last week my last shot of after 14 of this antibody therapy, and yeah, I'm so happy. But there is something else I would like to mention, and just to let you inform. I will also, part of my treatment, besides the chemotherapy, the antibody, and the hormone therapy, there is something that is called, well, I'll put it here, but it has to do with metastasis in the bones. So this medicament, I'm receiving it 2 times a year. So this year I already got my shot, and I will get it in March last year. So that means I'm getting everything. This is something I forgot to mention. I have here a port, so I'm not getting the chemo like here in my vein in my arm. Rather, here I have a port. So I cannot get rid of it, of course. So yeah, I'm getting this medicament, and what it does is, well, I don't know, you can read about it. All I know is that I need to be aware of my teeth. It gets very sensitive, so I have to be very hygienic. I mean, I was already hygienic. My mom is a dentist, but now double 3 times, because right away once I eat I feel it's so sensitive, and I start kind of bleeding. So yeah, you can read about it. I mean, I'm sure there's information, good information about it. So this is part of my treatment to prevent that the cancer comes back in the bones because of my diagnosis. So yeah, I still have to go to under this medication for the next 2 years, plus the hormone therapy, which include the injection and the pill. So yeah, what can I say more about the hair? Well, I already mentioned the symptoms. Oh yeah, now let's talk about the recovering process. So the recovering process. My biggest battle during my chemotherapy was to eat. You have to take your greens, good quality food, your proteins, especially because I was struggling, and I'm still with my muscular, but well, not anymore actually, not that heavy. But to gain it, I was losing weight so quick after my chemotherapy, and I could barely eat. But that was my only task. Like, I was responsible to eat. I have to force myself, even if I remember I couldn't barely eat, that I have to put everything in a mixer, like the soup, the chicken, the rice, everything, just to eat it. At the end, it doesn't matter. Your body needs to eat. So one of the first thing is eat properly, healthy, good quality food. When I say good quality food, well, if you can get it bio, organic, invest in it. Yeah. Your supplements, I was taking vitamin D and magnesium, potassium, and yeah, but also good quality. But I'm not gonna go into this topic. I will mention in the description down below what magnesium, what potassium I consume, and vitamin D, not really. This you can get it anywhere. Ask your doctor. So yeah, I was eating properly, like like vegetables, protein, as I mentioned, good carbohydrates, and always I tend to do Pilates. So I was not, of course, doing heavily, but I will try to keep stretch myself, particularly 1 week before my next chemo. Other thing is rest, really rest. Put yourself good movies, Disney movies, something that makes you laugh, even if you cannot, just something to distract yourself. I was also taking this time when I felt strong to learn. As I mentioned in my other videos about, in my case, I am into data analysis, so I was trying to keep myself as much as possible informed in doing exercises, so also improving in the language. So I was distracting myself, but also pretty much of the time I was sleeping. I tried to keep myself active. If I can just wake up and clean a little bit, then I went back to bed. But always keep yourself busy, and if you cannot then sleep, rest, anything. When I went to rehabilitation, I was of course in that teach. I was told what exercise to do, particularly because of the implant, to recover mobility of my arm, and some other exercise, particularly in the pelvic area, because when you go through this hormone therapy, well, your hormones are getting blocked, so you lose actually wetness, you get dry, your muscles change, so you have to do particular exercise. If you cannot go to rehabilitation, if you unfortunately going through this process, I send you blessings, but do your research and keep yourself healthy with food, with exercise, and in your head always picture, as my dad says, a very pretty movie. Because these three pillars, physical and emotional and mental inputs, positive ones, good ones, productive ones, will really significantly help you in your recovering process. So I will probably, let me know if you want me to go more in detail about particular topic, or whether it's symptoms or blood tests or diagnose. I will also do more research about it and see what more information I can get from this video. Right now I kind of improvise and try to organize in my head like the main points I wanted to inform you. But my goal from this video is really to help others, because I did my research when I went through this, and I'm very grateful to the people I reached and the people who have posted their stories, because it really helped me a lot to understand and to be positive and to change your mind and to do something to overcome this, because it's as I said, it's a test of life. Everyone go through different things, so I went through this, and it happened to me, and the same way other people are using these platforms to inform, even if they're stories, well, I want to do the same. So again, I hope you find it helpful, and let me know if you want me to dig and to inform you about a particular topic. Thank you very much for listening to my story.